Uh, so let's start our presentation today. Our first case is a 12-year-old female patient presented with foot pain with normal x-ray. Okay, she did an x-ray, it was normal, persistent foot pain. Just a second, give me 1 second. Yeah, go. So what's this sequence? شنو؟ بنتك او ابنك؟ What's the name of your son or daughter, the biggest one?
مينا
Biggest one.
روز.
روز؟
بنتي.
روز؟
روز
ام روز. يلا what's the sequence؟ ما نقدر نقول اسماء خاف لا تزعلون. فالكود نيم ام روز.
لا ام روز حلو يعني.
حلو ما اختلفت. ها. What is this sequence؟
تيون؟
لا
تيون وفاتك مو وايد.
فلير. diffusion.
لا
مو diffusion. So what's this exam؟ ايش مكتوب هنا؟
هذا لوكالايزر يعني؟
طبعا. This is a localizer. You don't use that to see anatomy. What's this exam؟
هذا تي 2.
This is T2. أي؟
ساجيتال.
T2 sagittal. شنو بعد؟ فاتسا. Exactly. To be precise, to be properly scientific, it's proton density.
هو البروتون هم تي 2. مو؟
Proton density. أكو ثلاثة T1 و T2 proton density. In the musculoskeletal we don't use T2. We use proton density. احنا نقوله T2 fat cell. When we talk we say this is T2 fat cell, but it's not T2 fat cell, it's proton density.
يعني بيبون عادة هذا.
It's usually proton density.
دكتور
نفس الشكل but it gives more anatomical details. ليش؟ لأنه البروتون density هو somewhere بين ال T1 وال T2. And we know that T1 is used for anatomy and T2 is for pathology. So to mix them both we use proton density. Okay? بالmusculoskeletal بالbrain ما يعني مو ما يفيدنا بس it's not used as much as musculoskeletal. long من هو ال T2 لو T proton density long T1 TR short T. It's something بين ال T1 وال T2. Yeah. So this is a sagittal T2 fat sat or a proton density fat sat of ankle joint. Show.
There is increased signal intensity in the calcaneal bone.
Amazing. Very nice. أول شيء شايفت الكيس قبل ولا؟
لا مش شايفينها.
Anyway, no problem. حتى لو شايفينها سوا. Okay.
Also there is fluid.
Fluid. When fluid? I don't know. You tell me. You are the reporting radiologist. Ya Allah. What do we have here? Yalla, describe what do you see? Coronal. T2 fat sat or proton density fat sat. شيء عزبي تقول no problem.
Same we have increased signal intensity in
Where?
calcaneum.
Calcaneum. Or talus.
talus هذا talus.
زين وين الكالكينيوم؟ زين. So there is some increased T2 signal intensity of the calcaneus.
مو عندها هم نفس increased signal intensity at
Okay.
the insertion of Achilles tendon.
Okay. Let's see another sequence.
هذا axial.
Okay.
same هم increased.
Excellent.
هنا هم عندها.
So there is an area of increased T2 signal intensity, which means
bone edema.
bone marrow edema. Bone marrow edema. Not bone edema. فرق.
Bone marrow edema.
زين. What else? انزل شوف لنا other sequences. غير again this is the sagittal.
What you wanna?
Yeah. This is T1 weighted, non-fat saturated, sagittal of the ankle joint, showing
هو يصير هذا صار له
شنو له؟
له المكان
اوكي يعني شلون تكتبي بالريبورت؟ كتبي لي ريبورت.
low signal intensity involving calcaneal apophysis.
low T1 signal intensity لازم تحددين.
low T1 signal intensity involving calcaneal apophysis.
تمام. So what's our I don't know diagnosis, differential, impression, whatever. هسه شلون نكتب له orthopedic surgeon.
bone marrow edema, calcaneal apophysitis, infection,
first.
repeated trauma
Repeated trauma.
at age of 12 years, doing sport, jumping,
So repeated trauma means what يعني?
stress fracture مثلا.
Stress fracture.
Stress fracture يصير calcaneal apophysitis second.
So I'm the father of this young lady.
Yes.
I am at your clinic. What do you want to ask? Again,
Any repeated sport.
we are clinicians. We are not photographers. So,
Asking about activity.
you need history.
History.
أخذي history. اسأليني.
Any activity repeatedly doing.
She loves dancing. She does not stop the jumping on the bed day and night. She's like a crazy teenager. So,
calcaneal apophysitis.
Calcaneal apophysitis or
هو
stress fracture. Stress, exactly. It's repeated trauma on a normal bone. So, regarding why it's not an infection?
There must be fluid collection.
Okay. Fluid collection is not prominent enough.
Tendon insertion. يصير بها. يصير
swelling, which is not present here. What else? Very important thing.
Fever
and redness and hotness.
Yes.
The signs of infection are not there. Okay? And the young lady is healthy, wealthy. She's good. She's sitting in front of me, playing and doing whatever. But she's like crazy. She can't stop for 1 second. She just moves. Hyperactive. Okay? So this is a very straightforward case of calcaneal apophysitis or stress fracture of the calcaneal apophysis, whatever you can call it. All she needs is some rest, and that's it. Okay? Thank you. Sorry? اسألي.
هذا إذا عنده أكيلس تندنايتس يعني ما عنده swelling وماكو فيفر.
Okay.
بس هنا يعني لازم بس نشوف الأديمة بالتندنس insertion.
Yep. Tendinitis means inflammation, not infection. Inflammation is different from infection. Infection, there is a bacteria causing infection. Inflammation is just inflammation, just edema.
Just edema at the site of tendinous insertion.
Yep. What's the defined severe? تمام? So there is no signs of avascular necrosis here, and it's not the location. Just a second, wallah. Yeah, this. Sorry. It could be some of these cracks. You can see bil apophysis. There are some thin linear cracks. Most likely these are not all due to growth plate. It's some of them are fractures. زين يلا next. يلا اختار لك رقم. Choose your poison. 20. Oh, going way back. Let's see. 20, 20, 20, 20, 20. Okay, nice. Nice. 20 20. يلا خوش اختيارات دا تختارون حلوة. Where is 20؟ شايفين هاي مال الدمبلة صار هيك كل واحد يختار 20 دمبلة.
كل على نفس
اي والله دا تيجي هيك. هو مرة يعني. So this is a 28-year-old male patient presented with thigh pain. Thigh pain, I think right thigh, if I'm not mistaken. So, this is stir or T2 fat sagittal of the thigh, maybe I think right thigh, showing Bawa, أعلمك شيء during the exam, if you don't see something that catches your eye in the first sequence, don't waste your time. Just go to the next one. You're on a clock خلينا نقول. إذا شفت شيء يعني بعينك تشوف إجا بعينك okay, look for more details. But if you don't see, just skip it. بعدين تقدر ترجع له عادي.
high low signal areas or
شو مدري يعني.
axial. This group شوية increased signal.
So there is an increased T2 signal intensity seen involving the muscles of the thigh. Which muscles?
High posterior group.
مش مدري يعني انت قول لي posterior or anterior.
Posterior.
Posterior group. Which muscle?
Hamstrings.
Hamstring. So there is an area of increased T2 signal intensity seen involving, I don't know which muscle, you have to tell me. Huh? خلصت وراحت. احنا ويا الكوفي نشد ايفي بس مو اورال.
جيب لك ماك هالمرة.
يا والله بس شفنا هاي.
So, what's your report? What you're gonna write in the report? Do you really need contrast for such a... Is there like a lesion or abscess or collection or whatever to give contrast for?
Maybe infiltration.
First of all, you need to identify what's the pathology. So the radiological abnormality is an area of increased T2 signal intensity in one of the muscles of the thigh. Second question, what muscle is that? I need you to tell me the name of this muscle. Anatomy. ما جاي وياك يعني بشيء beyond your level. It's just anatomy, basic anatomy. And the best way to identify anatomy in this case is to see it on axial images. You will never understand anything on coronal or sagittal. Which muscle is this? Let's wait. Which muscle is this? This is adductor magnus. صح? So which muscle is this? ويا الماجنس شي يمشي؟ هم ثلاث.
Grasses medium.
عودتي. قولي الادكتر جروب. شنو؟
الادكتر لونجس. بريفيس وماجنس.
زين هاي ماجنس من وين؟ لونجس طبعا الدكتور لونجس اكيد ماجنس اكبر هيك ابسط من لونجس. هاي انتهينا. الدكتور لونجس T2 hyper intensity at شوف السايت شوف الاناتومي of the muscle. Which site? اصعد go up. So هذا down. Go up اي بالضبط هيك اصعد بالثاي. So you can see this is what? This hypointense tendon of origin. صح? This is the tendon. And this is the belly of the muscle. So this is the site of the musculo-tendinous junction. Which is the most common site of what pathology? She said with musculo-tendinous junction. Tear. The most common site of a muscle tear or laceration or injury is at the site of the musculo-tendinous junction. So now we are going in the direction of a partial, طبعا there is no muscle retraction. So there is a partial tear of the adductor longus at the site of the musculo-tendinous junction. So, I am the patient. What do you need to prove your theory?
History.
You need history. Again, we are clinicians, we are not photographers. So, what do you want to ask? Sport, I'm a football player. So that's a sport injury, okay? With a partial laceration of the muscle of the adductor longus. It doesn't matter if you specify adductor longus or not, or at least one of the muscles of the hamstring component. Okay? Good.
هاي سيجنال كله شنو؟ كل المصل.
Edema rupture. Torn muscle fibers. I think we have time for one more case. اعتقد يعني استحقيتي بعد طيناك الاول والثاني بعد حلت زين. نختار لك شيء لو تختارين؟ بالله اختاري انت رقم خلينا نشوف.
عادي يعني كل شيء عادي.
هو that's the way to approach it. If I'm at the clinic, some patient come, I have to do it no matter if it's hard or difficult or easy. I have كل report. That's a very good approach. زين. So اختاري بالله انت رقم وخلي انا اشوف يرحم لولا. لل 440. 26. لا اكو بس يعني شو نقول مو مستويات يعني. لا. زين دقيقة. خلينا نختار مو كلش difficult بس يعني it's a combination 37. So this is a female patient, 40 years old. She has abnormal pelvic ultrasound. So MRI was requested.
She's married?
Yes, she is married. She's not pregnant, but she has children.
Okay, this is coronal T2.
Okay. By the way, أعلمكم فد شغلة. Any pelvic exam, CT, ultrasound, MRI, يعني in the exam setting, رأسا أول شيء ask pregnancy test positive or negative اسألني رأسا قبل لا تشوف. Okay. طلعة من الطريق. دائما ask PT positive.
Okay,
In this case it's negative.
Okay, this is T2 coronal.
Good.
Showing the uterus to be like normal size.
Good.
Looks like normal size and endometrium normal.
Nice.
Preserved the junction. Yes.
Love it.
Okay. I see one hypo-intense signal within the myometrium anteriorly. I see the other sequences. Maybe
Sure.
fibroid, maybe.
Okay.
Okay. In the right adnexia there is this cystic lesion, a multiloculated maybe cystic lesion, or it is 2 or 3 cysts, I don't know.
Probably complex cystic
yes.
lesion.
With the high signal, mainly high signal intensity.
Nice.
There is in the left adnexia, or mainly it's in midline, there is the rounded hypointense signal
Good.
with some small hyperintense signal at the periphery.
Okay.
Okay. Then I will see this one. This is
هاي
this
نفسها.
is the same. Yes.
Yes. وهذا قبل الفلتر وبعد الفلتر. شوفي
Okay,
شوفي
this
هذا
axial
هذا
torsion, yes, axial.
هذا فلتر بتر شوي احلى الصورة مالتكم.
This is also axial G2. Uterus almost normal with this fibroid, I think.
شوفوا وبعدين a lot of شلون training for the eye بسهولة تقدر تعرف هذا مثلا تسوي بفيليبس MRI ذاك كان بسيمنز MRI. هاي الكواليتي مال الصورة هاي فيليبس كواليتي ذيك سيمنز كواليتي. Anyway, sorry for interruption.
Here it's the same findings. This hypo mass intense signal in the left adnexia and multiloculated cystic appearing lesion in the
Good. So all the sequences now we saw are T2.
Yes, T.
So we need further information by seeing
This one T1.
T1.
That's same T2 this one. Okay. This is T1.
Mm-hmm.
So
Wait.
the lesions in the left showing high signal,
Mm-hmm.
and the T1 is high and T2 low.
Good.
So this may indicate blood.
Mm-hmm.
And here in the right adnexia, this one low in T1 and high in T2, those cystic lesion.
Just
And the other one is high.
you're doing amazing. Just let's make it easier for your colleagues. أوفي الماوس حتى يستوعبون الفكرة يعني خلينا نقول. نحط ال T1 sorry ال T1 with T2 next to each other so that we can differentiate. So let's come to the first lesion, which is this one. On T2 it appears what?
It's high on T2
It's high in T2
and low on T1.
and low in T1. What about this thing here?
This is high in both.
High in both. Okay, suggesting
Maybe fat content.
could be fat content. Now, what about this one?
This
It's
one high in T1 and low in T2.
and low in T2.
With blood. This indicates blood content.
Blood content. Excellent. So, what else do we need?
Fat sat.
We need fat sat. Exactly. Let's do a 3-section. Just give me the mouse, please. It's easier for me. أو ممكن نسوي بهالشكل أفضل يمكن. تمام. Let's see. this بس حتى يطلع بال now كلهم نروح نسوي sorry let's unlock them good like that now we have the T2 تفضلي
Just another question. Is the patient in pain?
no
In pain?
no maybe some bleeding but not pain
Okay, this is fat cell sequence.
okay
I see this one, as you say, the cystic lesion is
So,
suppressed.
let's start it's
Yes.
hyper
Hyper.
hypo
Yes, hyper. So it's
not removed by fat cell
This is cystic in nature.
so this is cystic with containing what hyper hypo and not suppressed by fat cell basically it's fluid
Fluid, yes.
now this other component the small one this one
Suppressed. This is
it's
fat content.
hyper suppressed on fat cell
So this is
fat
fat.
so indicating that this complex lesion is just a
Dermal.
dermal هاي رقم واحد هاي خلاص نروح نجي للسكند this thing is
Hypo.
hypo on T2 hyper on T1 with and it's hypo on T2 so of course it will be hypo on T2 fat cell
Yes.
so indicating that this lesion is
It's blood.
blood so it's a
Hemorrhagic.
hemorrhagic cyst so we have dermoid hemorrhagic cyst and we have وينه we have this thing here
This is your pediculated fibrin.
this is a it's hypo hypo it's just a fiber
Yes, pediculated.
so we have 3 lesions in the pelvis of 3 different pathologies in the same patient
This one.
we have hemorrhagic cyst we have fibroids and we have a dermoid all of them in the same case by just analysis of the signal intensity on T1, T2 and fat saturated images we can reach the diagnosis of each one of them without the use of contrast we don't even need to use contrast okay so ممكن يكون عندنا multiple pathologies in the same patient unlikely rare but it happens and by just knowing what kind of signal each lesion has on each sequence we can reach not a differential a diagnosis like a provisional diagnosis okay
So this one is soft tissue content within the cyst.
dermoid it has everything it has fluid has fat has tooth and hair and whatever you like but by presence of fat signal intensity it confirms that this is a mature cystic teratoma or a dermoid
هسه هذا ستير
yes
إذا نسوي فات سات.
هو still fat cell T2 fat cell
هو هذا السبيسيفيك يعني
مم.
فات.
مم.
هذا اللايبوما suppressed
طبعا
and the blood content will not suppress.
will not suppress yes
You can differentiate.
yep sure طبعا okay thank you very much see you next week inshallah yeah هلا